So welcome to the August 21st, 2023 meeting of the Yarmouth Board of Health. And to start with, let's do the attendance. And we have a very nice attendance tonight, and that is we have a new member, and that's Dr. Lawrence Venezia to my right. Welcome.
Thank you.
And looking forward to working with you. We've got a long
Looking forward to it as well.
Yeah, long history in health services here in town,
sure.
and your expertise will be great.
Yeah, hopefully I can be helpful. I'll certainly try.
I'm sure you will.
Yeah.
And if you have questions in the meeting, just ask.
Sure.
Everyone else does, including myself.
Okay.
If something's not making sense, I speak up to make sure I'm on top of it, and
Yeah.
please do the same.
Okay.
All
I
right?
think for a while, I'll just keep a low profile and listen.
This is your call.
Okay. Sure.
Okay?
Okay.
And the dress code, there isn't, okay?
I see that.
Good. That's for you, the next meeting, so you'll know.
Mr. Chairman, if I could, there were several candidates that the board interviewed, and Dr. Venezia was a little bit on scheduling, but then there was a vote that was taken, and Dr. Venezia has been sworn in and taken the training that is required to be a full-fledged board member. So can't thank you enough for stepping forward. You certainly will add value.
Thank you.
We're confident of that.
Sure hope so.
And Dr. Venezia, you and I are not the only ones here. Let's continue on attendance. Mary, are you present?
Present.
Okay. Eric? Okay.
Present.
Charlie is not. Okay. So why don't we move along? There's some little statement here I need to make each time for the time being, and that is this is a hybrid participation meeting, Zoom or attend by coming here to Town Hall, essentially. Let's make this as short as we can. Specific information such as instructions and guidelines for remote by members of the public and or parties with a right and or requirement to attend this meeting can be found on the town website. For the public portion of this meeting, members of the public who wish to watch, listen, and participate in the meeting may do so, and just go to the town website. There'll be some instructions there of how to go about it. Okay. And Jay, I see you put together a long agenda here tonight. Okay.
We have a few things. Well, I know it's a later calendar for the summer, but we have a number of things that the board needs to attend to. So we'll move it along. We'll be fine. But these are things that had to be they couldn't wait any longer.
Okay, we're off and running then.
Okay.
Okay, public comment. Is anyone here who's present or who's zooming in or has called in? This would be the time to address the board. Any questions, comments, we welcome all of it. Sounds pretty quiet. Anyone calling in, zooming in, knocking on the door? Nope. Okay. Number 2 here on the agenda is International Overdose Awareness Day. It says Dawn Roche. And is Dawn here? And Dawn is here then. This is in reference to Smuggler's Beach, August 31st, 2023. I saw the board driving in here with the lights on and just announcing all this, which is great. So, please have a seat, and just for the record, state your name, and it's all yours.
Yes, thank you. Thank you for having me. Thanks, Jay. So my name is Dawn Roche. I have been a Yarmouth resident for 27 years. I'm on the Yarmouth Substance Awareness Committee, along with Parents Supporting Parents on the Cape. I do a couple of different organizations throughout the Cape. More importantly, I'm a mother. I'm a mother of 2. I'm gonna cry. I'm a mother of 2. I lost my son, Trevor, to fentanyl here in town, July 6, 2018. And ever since then, I made it a mission to give back. So August 31st yearly is International Overdose Awareness Day, which is a day that people come together and remember those and honor those that we have lost. So my first August of 18, after I lost Trevor, a group of us parents on the Cape went up to Boston. And I said, this is crazy. Why are we going so far when we have a huge epidemic on the Cape? So I took it upon myself. I started the one at Smuggler's Beach in 19. I've had it ever since. It's just a day that we all come together and we honor and remember those that we've lost. And we also pray and hope for those that are still struggling, because there is a lot out there. I ask a lot of parents to bring a life-size, I don't want to say life-size, but a good-size poster of their child. We have about 45 angels that I travel with, and this is my son here, so I line them up on the boardwalk at Smuggler's Beach. I have guest speakers. I have parents that come up and say their child's name and give a brief little story about them. I have a resource tables. There's probably a good dozen of resources on the Cape that will be there to provide resources and hope for those that are still struggling. We do have a sunset prayer and a candlelight vigil. So it is a beautiful event. It is now sponsored. A lot of the police departments are taking, sponsoring and supporting what I'm doing. I did also place the purple flags on the town hall. The police departments and the fire locally have them on the ribbons on their cruisers and all. Yeah. It's hard to talk about.
Yeah.
It is a beautiful night. It's a beautiful night where we all come together and support each other, because it's hard to talk to somebody who you've not walked in their shoes and.
Yeah. Thank you for your effort and just how driven you are for this cause. And I'm sorry for you, but I think what I'd like you to do is just state the time, the date, and
course.
everything again for people who are listening in.
Sure. So it is at Smuggler's Beach, August 31st, which is a Thursday this year. The event starts at 5:30. And please bring a beach chair or a blanket. And if you have lost somebody, please bring a picture of your photo, so you will have time to get up there and say your child's name or your loved one's name. Not everyone is somebody's child there, so.
Any questions from the board?
Just if I could, Don, you have a guest speaker this year, right? Could you
I do.
speak a little? The brochure will be on our website. I just wanted Don to be
Yes.
able to announce this tonight, and then on our the health department website, the brochure will be available. But if you could just talk a little bit about the guest speaker that will be there.
Yes, so his name is Jason Kay. We call him Kay because it's a very difficult last name to pronounce. But he struggled for years, a good decade plus. He's now been in recovery for 7 years. He is the top leading salesperson at Hyannis Honda. So he is doing amazing and gives back to others. So he reached out last year when he was at the event, just attending the event, and asked if he could please be the speaker for this year. So I absolutely said yes.
Perfect.
Yes. Thank you.
Okay.
Mr. Chairman, if you haven't been, last year was my first time there, a free event to come down, and the resource tables, Don, you do a wonderful job. It is a very emotional event. And whether you're a parent, a community member, anyone in the community, you can't help but be touched by this event. It really is something. You're going to bump into someone you know there. It really, that's how it was. I was
We're all affected by it, you know?
no question about it. It is a
Nice that
great.
the police support me and the fire department also. But now I have Barnstable doing the ribbons, and they will also be there with their hidden in plain sight trailer, which they've converted into a teenage room to show you where they hide the drugs and the paraphernalia. I also am supported by the district attorney's office now, and also the Barnstable County Sheriff's Office. So unfortunately and sadly, it's taken off, which is beautiful that we all have each other, but it stinks that we all have to come together this way, so.
But a wonderful tribute, Don. When I say a great event, it's a wonderful tribute. The courage that you've done to
Thanks.
step forward as parents here, the courage that takes.
Thank you.
We so admire that.
It definitely hurts, but it does get softer, so. I'm thankful I had him for 26 years.
Thank you.
Thanks.
Terrific. Okay. Don, thank you. And that was just simply that the chair and the board understands that the brochure will be, you have it in your pack, but also it'll be up on the website. And again, a free event that is emotional and educational. So I hope the community will see that. And Erica, if you could, just to put that, it's very poignant to see. It's quite an illustration that Don put out on the front lawn of our town hall, commemorating individuals that we've lost. These, over what period of time, how many flags we have up?
So that's 49. I started in 2015 when I really knew my son was struggling. Unfortunately, we could go back forever, but sadly, yeah.
Right.
We did had to obviously add a couple more this year, but
A strong visual.
yeah, it's
wrong.
very impactful.
It
And
is
I hope it
impactful.
starts a conversation piece because you don't know who's struggling or who has somebody who has lost. So,
Right. Or who isn't that? So that starts a discussion, like you say.
yes, and as do the purple ribbons on the police and the fire, and
Right.
so, thank you.
Don, thanks for being here, and we certainly will see you there.
Yes, thank you. Thank you so much.
Thanks for coming in.
Of course, Don, we'll see you.
Okay, number 3 here on the agenda is an update, and that's the Yarmouth Food Pantry. I believe we have Steve Albright, the President and Board of Directors. So,
Let's see here. There may be some people, are they looking to speak? Do you know?
any hands up there?
Okay. She's DPW. She's for the Plastic Initiative.
Okay. For the time being, let's move on here. This is number 4 on your agenda. It's an update on Article 34 and 35. Jay, can you just
Sure. So,
state what's up for tonight?
The executive director, who is not here just yet, she's hoped to be here in person. But this speaks to, Mr. Chairman, on, if the community remembers and the board remembers, back in April 25th, the last articles on the warrant, 34 and 35, were about restricting restricting the use of plastic in the community. And the executive director of that initiative was going to come here and speak to the board to inform them of what the public health and the environmental risks are and the intent of that. I have confirmation that she will be here tonight. I don't know if it's going to be in person or zooming in, but we'll watch for her.
Okay.
So we're just going to have to keep moving down until our
So somebody's here.
guests get here.
Okay, so number 5 here is a discussion, sample regulation restricting the sale of tobacco and vape products. I believe Bob Collette's going to join us tonight. He's the Tobacco Control Division Program Director.
He has confirmed that he will be here as well.
So Bob's not here yet. Okay, down to 6. It's an update. Associate Board Members, DY students. Jay, what's up?
The board has unanimously approved I call it associate or a public health ambassador, to support and really strengthen the discipline of public health to youth, so that they would be part of that. Unfortunately, I think with the new superintendent and a principal, making that connection has been a little slower, but I think by the next meeting, I will be able to come in and have a framework of what that program would look like. I'm thinking perhaps, and it was actually Mary who made the suggestion that perhaps we wouldn't just have a student, a male and a female student, but they could cycle in and out maybe for 3 months, give them a project. They would come to the meetings, they could maybe weigh in on some of the things and get a greater understanding of what falls under the umbrella of public health. So I don't have that framework just yet, but that will be coming forward. I thought it would be at this meeting. It'll be at the September meeting. We'll have a framework for. I like the name Ambassadors of Public Health. The young, youth will be here to. At least they'll have. I feel pretty confident I'll have names and a structure of. And the board may have some input as to what are some of the programs that they could be working on, presenting on, and get their opinion on, so that they see it from a youthful perspective and what the needs are. It may be far different than what public health and the work that we are putting forward now. It'd be interesting to just get another view from a high school demographic.
It's also it's an education that they're probably not getting at school to be this kind of position. Okay, so let's move along. Number 7 is an update on the cyanobacteria monitoring program.
Right. So you may have that, Erica. So that's always a concern, right, in the community. And I'm pleased to let you know, and the board has this in the package, in their packets, that this year that we did not have to have any closings, and that we were in good shape as far as Sinovac went. The testing continued. It's seasonal, it is problematic, but that we're fortunate in Yarmouth that we did not have to have any closings. And my understanding is, and again, my history only goes back, it's less than 2 years, but that in fact has resulted in some closings of some of the ponds and the beaches.
My only concern with this is having a better understanding of when there's a positive recording, okay, for cyanobacteria, the window of time before, is it retested first? At what point would a closing take place?
Right. So like the other, the E. coli and fecal, they'll do a second test, making sure that it wasn't a false positive. Those tests are done earlier in the week so that it typically won't affect a weekend. And we're looking for then a second supportive test to make sure that, to validate, if you will, the test results. And fortunately, both in the bacteria, the E. coli and the cyanobacteria, there really hasn't been the closings that has really been a problem. And typically, with a rainy summer like this, it could easily have been. And I was actually anticipating not hopefully anticipating, but expecting, I will say, that's exactly what the results were going to be. And they just weren't. We're fortunate.
Board members, questions, comments?
Nope.
Nope, I guess not. Okay.
Good news, good news.
Top of the next page on the agenda, it's number 8. It's an update on Yarmouth Animal Inspectors. I know there's some things in the packet, as well as some things on the table when Larry and I came in. So,
Thank you, Board. Barry Lewis, Assistant Health Director, Town of Yarmouth. You can see the 2 certificates, one for myself, Barry Lewis, and the other for Philip Arnold as the Town Animal Inspectors for the Town of Yarmouth. If you would like to vote on us being your animal inspectors, you're more than, I'd be willing to. I did give you a copy of our applications that we sent to the Department of Agricultural Resources that Phil and I both filled out, and Jay was more than happy to approve for us. So, on top of that, I did give you a list of the animal inspectors. I did give you a list of stable and coop in the town. In the town of Yarmouth right now, we have 6 stable licenses. We have 20 poultry licenses and 4 sheep and goat permits out there right now. So we keep an eye on that. Make sure everybody's in regulations with it. We do work with the
To me.
sure the stables have all they're following all the rules and regulations, state and city regulations on their stables and their coops and their setbacks and all that good stuff, so.
and have there been problems over the last few years that you're aware of?
Not since
I'm
I
not.
started there. I did get one this morning that someone has 2 extra chickens that they're not supposed to have. They were allotted 10, they have 12, so it's on my calendar. Go out tomorrow to go check it out and go talk to them, so.
Typically, it is not the sanitary conditions. Many times, the problem becomes, and the board is very familiar with this, it's the abutters, right? Where individuals, whether there's noise or odors, sanitary conditions, it might be vermin, the impact on the quality of life for, or they feel for the abutters, and many times that's why this comes to our attention at the health office operationally, and Barry and Phil would go out, and not as much in that, we don't pretend to have the skill set as far as the health and the well-being we just make sure, of the animals. It is more the physical requirements, the water, the cleanliness, Barry mentioned the setbacks, things of that nature, the cleaning up, the disposal, but also, to be fair, the abutters play a big role on this, and the corporation and the compliance of the owners of the animals plays an important role in this. The board is very aware of what that can do to the neighbors and to a whole neighborhood, quite frankly. So that's part of making sure that there's a strong understanding of what the responsibility is to have a stable permit, or sheep, or coops, things of that nature, and the respect that's required so that it does not negatively impact the abutters.
We've only had a few over the last 10 years that came to the board, okay, that we were aware of.
Yeah, I really couldn't see too much difference between 10 chickens and 12 chickens, but would there be a,
The neighbors can tell.
there'd be a census that they have to abide by? I see.
Yeah, there is a,
I mean, I could see a rooster, obviously, or not having a rooster, but chickens, I'm
but they're
not.
limited by capacity, that is set by regulation
Oh,
by
how is that? Obviously, there must be some rules.
in the town
the
bylaw. And that's actually on our website. Yeah, that's on
I
the
see.
town website, right.
I can become familiar with that.
Right.
Sure.
But with your background and your professional and long, lengthy career background, it's going to be helpful to us to be able to, not that you want call as a veterinarian, but
Yeah.
some of those things when they are in question, one of the instances came up today, if we could tap into your expertise on that, it would be very helpful.
Yeah, I'd be happy to offer some objective opinions. Yeah.
We'd be more than happy to take
I don't know if I'd make the neighbors happy, but,
Well, there's, again, these are rules and regulations that everyone's responsible for, and as long as the rules get followed, we're fine with it, but.
so there must be some kind of a rooster law in Yarmouth, is there, do you know?
I'm not familiar with that.
Okay,
I don't know.
It's not come in front of the board ever, anybody complaining.
okay.
We're not aware of any egg counts that anyone's doing either, okay, production-wise. So,
Only from the standpoint of they're really known to awaken the neighborhood at very early hours,
yeah.
right?
There are some roosters on our list on the chicken coop, I did notice, so.
Okay.
How often are inspections done?
Annually?
Annually.
And more often,
Once a year or with a complaint.
with a complaint, exactly. Yep.
Okay, so we do need to vote on this, so we really I need a motion for Phil and Barry for a year, I guess, to be inspectors, so.
I have one other question,
Oh,
Hillard.
great.
In the past, we've had more animal inspectors. 2 are adequate?
Mary, that's a good question. I don't know that past history. In the past, what I saw that what we had was that Phil was listed as an inspector, and I didn't think that one would be enough. So I had enlisted that we'd at least have 2, and Barry said he had agreed that he would be willing to do that. I don't know how far back that history goes, but I saw that Phil was the only animal inspector, so I added Barry to the list.
It's been difficult to get inspectors. I know we had one person who was inspector for years and sort of left the position, so it's been a problem getting people, that's all.
For animals, but not animal control, but a stable animal inspector, it has, okay.
Right.
All right.
They weren't staff members. The
Interesting,
person.
didn't know that, okay. So that was outsourced, that was a private or a group did that, or an individual?
Individual.
Yeah,
Is it a voluntary
someone who lived.
position?
I thought she got paid something, but I
Right.
don't think she was going to retire on it.
A stipend of some sort.
Yeah, that's all.
It,
Yeah,
I can tell you,
it's a nice thing to provide. You're not doing this for any money for that position.
yeah.
I'm confident in myself and Phil that we'll be able to handle.
I think two are more than, are
Yeah,
very
it-
adequate
it
for the
does-
town,
Okay.
considering what our population of
Exactly.
animals look like.
It doesn't come up all that often in our day. It really doesn't, honestly.
Okay. I move that we approve the animal inspector positions for Phil Renault and Barry Ellis.
Sure. Second to that motion?
I'll second that.
Okay, thank you. Any further discussion on this? See, there's none. Let's vote. All in favor, just raise your hand and say aye if you're in favor of this. And that's
Aye.
unanimous. Okay, that passes. Congratulations.
Thank you for your service. Thank-
Okay, Phil,
forward
if you're
to working
listening,
with you.
congratulations, Phil.
Yeah.
Okay. Jay, anyone from further up back in the agenda has arrived? Anyone?
I haven't seen anyone yet.
Okay, so let's go ahead now.
Right.
We're up to number 9, that's a discussion, emergency preparedness and tornadoes, excessive heat and flooding. I had mentioned this to Jay only because suddenly that's what's happening here, unfortunately, not just in Yarmouth, but around the globe. And I just thought that as long as I've been on the board, we haven't really addressed our preparedness, and it's complicated. Very often it'll have to do with communication, certainly first responders, police department, health department, board of health, and other departments in town. It's something I just thought we ought to put on the agenda maybe in September to talk about it a little bit. At some point, we should see what regulations are. I've never looked at them, anything relevant to this. The only big issue we've had recently, obviously, was the pandemic. Dramatically, I know there was one issue of storage of fuel in boats, about 4,000 gallons of it that was going to be, we were voting on whether it should be in Yarmouth, sitting over the aquifer or not, and there was an issue about, well, tornadoes. Well, no one thought there'd be tornadoes. This was a number of years ago, but here we are. So that's why I just added this to the agenda.
Mr.
Willard, I think that Carl should be part of this because he and I did both sign up to get the emergency alerts from DPH. So I think he would certainly be able to contribute to the discussion. And much more than I.
That's a great point, but over the past month, as you know, I get those same alerts, so he will certainly have Carl involved. But over the past month, there's been 2 different warnings, whether you've seen come across or the scroll that happens on your TV for a tornado, and that's very rare for the Cape.
Right.
So it is timely that we say proactively, right? If we can predict this, we can prevent or at least accommodate what this would look like as far as our capacity. I think, Carl, Mary, that's a very good point. Police and fire, I would invite them in. I don't know that we necessarily have. I think our emergency management falls within the fire department to ask that. And what role does public health play in that,
Right.
in that capacity, to have that discussion? And again, depending on the scenario, whether it's a power outage or an ice storm, a flood or a hurricane, and things of that nature, what role do we play? The board has tremendous power in that, as far as emergency preparedness. And that may have to be exercised at certain times. So it is very timely, especially given over the past month. I mean, a tornado on the Cape, right? Do we think so? I'll line that up for a conversation.
Get it started because it's complicated when you have more than one department and so on, and trying to coordinate things. But even if it's excessive heat, I mean, we have an old elderly population here. Not, many of us take it for granted that you have air conditioning. There are people who can't afford to have air conditioners at home, and have respiratory problems even without it. So I think it's great. We'll get started on September.
Yeah, cooling centers, warming centers, power outages. What is that? What's the trigger that, 3 days of 90 plus, does that trigger? What that is, and again, my newness here, there may be things already in place, but it sounds like the board is not aware, or maybe isn't part of those discussions.
That's correct. We haven't,
Right.
at least since
Right.
I've been on the board, we have not.
Right. No, and I assume that there is a town emergency preparedness plan, and I'm guessing it even mentions the health department or the Board of Health, so I think it's absolutely vital that we know about it.
Yeah, the Board of Health clearly plays an important role in that. But again, it needs to be formalized, needs to be communicated, input, things of that nature, and then just so that you're aware. You could be written
Right.
into a plan that you're not even aware what that is.
Right.
Okay, I think we're probably finished with number 9 on the agenda. I see we have someone joining the meeting. I don't know if that's someone who's on the agenda or not.
No, she's not.
Okay.
Person gonna be at 6:30. Okay.
Oh, I don't see anyone else up on the board there who's coming in. Okay. So we're just going to work our way down here. Number 10 here on your agenda, you'll see update on Human Services Agency's funding. That's for 2023-24.
It is. You have in your pack, and I alluded to this, it's very, very unique what the Yarmouth Board of Health does. Larry sees this list here, and the Yarmouth Board of Health sets aside $60,000 to support a number of agencies within the community, and just for the community's awareness, I'd like to just let them know it's AIDS Support Group of Cape Cod, Big Brothers and Big Sisters of Cape Cod, the Council of Churches Hands of Hope, the Duffy Health Center, Harbor Community Health Center, Audible Local Ledger, Capabilities, Independence House, VNA of Cape Cod, and the Yarmouth Food Pantry. Now, each of them are,
And site law services on the back page. Site law services too.
Site Loss Services. Thank you, Mary. That's very unique, that a board, a municipal agency, a municipal department would provide funding for Health and Human Services agencies. It just shows the support and the connectivity in the department, in the community. Well received. They have all responded back, have been written and executed with the town. And actually, my hope was, and I still have hope that he'll be here tonight, but that the president, Steve Albright, of the food pantry will be here to give a presentation. And also, I think, some thanks to the board, to say thank you for the longstanding support, not only to the board here, but certainly the Yarmouth community supports the food pantry in a significant way. And if you haven't been down to the food pantry, or the board members or the community listening, you really need to stop in and see what they're doing down there. Doing tremendous work. It's and you're supporting them as well.
Select Board has really supported us in providing the money when it comes
Right.
down to it. Yeah, so we,
Right.
as a board, we've done very well.
Yep.
Okay, number 11 here. This is an update, opioid remediation funds distribution.
So money has begun to roll back. It's been quite some time, actually. It was last July. The Attorney General at the time, Mara Healy, there was a settlement with Johnson & Johnson, 7-8 figure actually settlement. Well, that money has started to roll out, and Yarmouth has received its portion of that funding, and now that funding has been accepted at town meeting, and now it is actually hitting the agencies that do the work to help individuals that Don Roach had talked about. So within the first round of funding, the Yarmouth Substance Abuse Awareness Committee $4,800. AIDS Support Group of Cape Cod, $12,000. Yarmouth Comprehensive Treatment Center of $6,000. The Duffy Health Center of $22,000, and the Recovery Support, the Navigator of $15,000. So the money that you hear, I've talked about, you hear about the big announcements, and this is a national settlement that happened. Now it's actually coming right down into our community to do the work. And Don alluded to it. It's the YSAC group. It's the Yarmouth Substance Abuse Coalition. We meet monthly, if not more, when necessary. And these are very planned and strategic. That group has been in existence for about 8 years. This is the first time they've actually had funding. A lot of it has been awareness, right, having a discussion, but this is the first time now they have capacity, financial capacity to actually to move things forward and make a difference, right? That's what it takes.
Yeah, now, they decided on distribution and
They did. It was a committee. Now, that committee, when we meet at the police department, sometimes I zoom in, but on any given meeting, there can be upwards of 15 to 20 individuals, a diverse group from faith-based organizations to service and nonprofit. Educational groups are involved, and there's a selection process to that, deliberative process as to what's the best way to use this money. So this isn't a committee of one that's deciding this by any means. It's the YSAC group that votes on this, and they've allocated this funding. There'll be more to come. The Johnson & Johnson distribution dollars are over 15 years. You've probably read in the paper, Walmart, CVS, Walgreens, those settlements are coming as well, and it'll just increase the capacity. So hopefully we'll have some more programs to put in front of you, but that's the first kind of rollout of the opioid settlement dollars.
who has the authority or the responsibility in Yarmouth to seek out money, in other words, from these lawsuits? And there'll be a major one for opiates when that gets settled as well.
Right.
Down there, with the Sackler family. So, who in town speaks up and has that authority?
So that isn't done by each individual municipality, the 351. That's actually done through the Attorney General's office. And this was done across the country. So the Johnson & Johnson was a national settlement that
Right,
was
but
done.
maybe I'm not being clear. In other words, how does it get distributed by town then? In other words, what town is receiving more money than the next town, or how does that work?
Right. So there's a calculus to that. There was across the country, and it's interesting you bring that up, and I'll allude to it. We're not satisfied with the.
I know that.
With the amount that we received.
Yeah.
If you look at we looked at it across population and fatal and non-fatal overdoses. We received about 1/3, what we feel,
Right.
In equity, as far as equitable distribution. So we've had myself, the town administrator, and the Barnstable commissions have helped us. I have sat in on those Zoom meetings, and we now, the town administrator is now writing to our state representative and our state senator, because there is a remediation fund. Not only are the cities and towns receive dollars, but the Commonwealth receives a remediation fund. And that fund is north of $600 million. So we have looked at this. This isn't a few dollars. We've received $275,000, where like communities are receiving over $1 million.
Right.
So we have written and talked, and we're advocating to say we think there's a solution here. The Attorney General's office, their response was to say, we don't have money to correct this, and we're not going to reopen a national negotiated settlement, and we understand that. But there is a solution to this, because the Commonwealth, the remediation fund, the trust fund, sits on $600 million to upwardly adjust Yarmouth to a meaningful level where we can actually implement the strategic plan that the YSAC group has involved, and it's about $1 million a year. Now, again, 200, these dollars, they didn't even exist before, but it's far less than, and we don't want to, than other communities, and we certainly don't want to take money away from any other communities by any means, but we want our fair share. And it's undeniable. It is, you have to concede the obvious when you look at the calculus and the spreadsheet that Yarmouth did not receive its fair share.
So what could we do differently when the next, settlement comes along? Because it will. As a town, what should we do differently?
That's part of our concern with the Attorney General's office. You're bringing up very good points to say, this will set a precedent, the J&J, because later on, that calculus will be used in the Walmart, in the CVS, and the error will continue to be repeated. And we think it is exactly that. We think there's an error here. And there's three different, determinations, indexes that they use, and we said, this has just been done wrong. We don't think it's intentional. We don't think in any way someone did this divisively or in any way punitive to Yarmouth, but the numbers are clearly wrong. They don't make sense when you compare us across the board. We have reached out, I did as recent as last week, and then to Bob, the town administrator, to the political entities, and we're hoping for a presentation to them so that we can correct this.
Okay, great.
It's going to be a difficult battle, but we're not stopping because and again, it's not a small delta. It's about $1 million delta here, difference that Yarmouth has not received. And that's a meaningful difference in services to, as Dawn just explained, what individuals are suffering with in the community. This touches across our whole community, right?
Yeah. Okay. Next update is on coronavirus, and specifically, I guess, the positivity rate. We had something in the packet and also on the table here. This was not in the packet. It's this.
I'm going to ask the board if they would weigh in. Those joining us on Zoom, I received an email today from Phil. Are the latest, going back to the middle of last week, Yarmouth's positivity rate was 5.57, 16 positives. The county is at 10.33, and the state is at 9.31. So we're about a half the county and a 3/4 of the state. But Mary, I'd be curious on your input. There's a little bit of an uptick going on here. We see it in the community.
Right. I mean, you're not counting my husband and I, who just finally got it August 8th. And we home tested and, didn't report it. So as we've already noted before, I think there's probably even more out there. I've just walking in the neighborhood, hear from neighbors that I just got it too, or I have a friend that just got it. So I think it's definitely out there, more than we realized.
Yeah, and it's concerning, and we're in the warm weather months now, right? Windows are open, people are outside, and we are seeing, not to set an alarm, but it's certainly cautionary that we are seeing an upward tick in our COVID rates. Where at a time when the vast majority of testing is being done at home, and so the community understands we don't have any test kits here. There is no distribution pipeline right now for test kits from the state or the federal government.
Yeah, the deadline for Medicare also, they're not handing them out.
Right.
Right.
From the pharmacy.
But some insurance companies will cover the cost, so it's worth at least exploring that if you need to get some.
Right. I don't know. I know Erica puts those slides together. For the longest, probably over 2 years, you had a COVID-19 update, and that has just gone away over the past probably 4 months, 3 months maybe. That may be something that the board will want to certainly keep an eye on, and perhaps we have to reinsert into the agenda. Hopefully not.
Right. I mean, the most common variant is a new one. I think it's referred to as EG5. There's a new vaccine that's going to be available, I think, next month. And it's also early fall's time for those who are so inclined to get a flu shot. And you can get them at the same time. You can ask your health provider, but from everything I'm aware of, you could go and get them at the same time. So, an ideal time, certainly September, October would be, I think, a great idea for people.
Barry, do you have an update as far as you're starting to schedule? You don't have a date certain yet for our flu clinic?
Not a certain date. Carl and I are still working, getting a hold of St. Pius for the location for the flu clinic for the town, yes.
Okay. And the other, Mr. Chairman, the other piece is that school's going to be getting back in session, and that's another concern for potentially an upward adjustment in the positivity rate as well.
There's also, if you're probably listening to news or reading news about the RSV, which is the respiratory syncytial virus, and it's an infection in the chest, in the lungs. It's fairly common over the years, certainly with infants. It's been recognized that the elderly are getting it as well and getting quite sick. With actually a significant mortality rate. And recently, the recommendation is for individuals over 60 to get a vaccine, and that's for the RSV, for respiratory syncytial virus. So people may want to speak with their health providers about it. Certainly, it's warranted for infants and people who are immunocompromised would be a good idea. So it's people who are over the age of 60, and we do have a large elderly population here. I'm not saying 60 is elderly, though, okay, everyone? So.
But I'd just like to put in a pitch for mask wearing. I think that it's prudent for people who find themselves in crowds or in places where they usually are not, and there are a lot of people to think about wearing a mask. I know it's kind of not popular or widespread, but it's just a simple measure that has been proven to be effective.
Thank you, Mary. Yeah, I agree. Okay, let's work our way back here, which I see would be item number 5 on the first page of the agenda, and this is a discussion, sample regulation restricting the sale of tobacco and vape products. Jay, maybe you could introduce what we're up to tonight and our responsibilities as a board.
Sure. So, the board remembers at the July meeting, I just introduced so that you would have information to look at, and these were sent by Bob Collette, of the state regulations and how that differs from in the Yarmouth regulations. Tonight's, the hope was, Bob is here now to walk us through that. Some time ago, probably 6 to 8 months ago, the board adopted the penalty procedures. Just that one segment, one provision within the state regulation. This would be to take the next step if the board is inclined to either mirror or move in the direction of some of the provisions that are in the state regulation. I'm going to let Bob explain what those are and maybe his recommendation as it compares to maybe other communities where the trend or where the momentum is going as far as we march towards this restriction to tobacco, because we know the scientific and the medical effects are very clear. The evidence is clear that smoking is not good, and these are the regulations that are needed. This has gone on since 1964, right? The warning label on the tobacco products. This is 60 years later. We're still public health is fighting this fight. So, Bob, if you could come up.
Welcome. Nice to see you again.
Thank you, Mr. Chair. Mr. Lewis, I've known for several years now. Mr. Venezia, nice to meet you. Bob Collette, Director of the Cape Cod Regional Tobacco Control Program. So I did speak with Jay and Phil a couple of months ago. We sat down and discussed some of the changes that the board might consider to bring the local regulations here in Yarmouth up to the statewide minimum standard, which of course is desirable, and in some cases, some would even suggest that it's illegal not to have your regulations at least to meet the statewide minimum standard. So you do have a strong regulation on the books already, and I commend you for taking the move of adopting the state fining system and the penalty phase of the state law, which was in effect since 2020. And several of the local municipalities have either adopted that portion or several of the policy changes that we are recommending since that time. And we're working with others concurrently as we speak. So Wareham and Bourne are currently looking at this. I've asked Provincetown to examine their regulations and see if we could work with them to upgrade theirs. Harwich has passed it just recently, about a month ago. And in Chatham, I don't know what they're up to, but Brewster recently, a couple of years ago, Brewster updated their regulations. They would need to do the penalty phase. But even if a local municipality chooses not to adopt any of these provisions, they're still compelled to use the fining and suspension system set forth in the state law because it supersedes what currently exists in some of the local regulations. So you have a checklist on the front page of the document that I provided to Jay and Phil. And like I said, several of these already exist in your current regulations. But we can go through them, and if you have any questions, I'll then we can discuss. We can stop and discuss those. So I think number one is already existent in the current regulation. That is, if you, at the end of the year, when it comes time for permit renewals, if an outstanding fine that has been imposed as a result of an illegal sale or any other violation of your local regs, it has not yet been paid, then the retailer would not be issued a permit at that time. So I think you probably already have that, Jay. That's right. A new one under number 2 is to deny a permit renewal if there have been 3 illegal sales to minors over the past 3 years. So you do have, I believe, a 36-month tolling period in your current regulation. So this would disqualify a retailer from continuing to sell tobacco sales at the end of the given year of the third violation.
So Bob, if I have that clear, that in essence revokes their permit, right?
Right. So if you have a permit cap in town, you do, right? You have so this would help you achieve that goal.
We're at 29 right now.
29, right? So this would help you move toward that goal. And it's a hard line in the sand, if you will, that the board would draw, reflecting the serious position that the town takes on illegal sales. And again, that would be within the 36-month tolling period. So you have the capping provision that's explained in number 3, or suggested in number 3.
Excuse me, what's the dual cap?
Cap.
The dual cap, let's see, is for, let's see, a simple cap, reducing cap, dual cap. That's a brand new thing, and I don't want to give you any misinformation, so I can get that to Jay, but, you have the simple cap, and the reducing cap, actually, in the regulation now.
Yes.
So,
Right.
I'll get that information to
Great,
Jay.
thank you.
And then I believe you have number 4 already, no new permits within 500 feet of a school.
That's it.
And there would, number 5 would be another additional density strategy, but no new permits within a certain number of feet within an existing permittee. So you could choose either 500, 1,000, or 2,000. So this prevents clustering of tobacco retailers. Let's say if you have an intersection where you have four corners, you don't. There are several examples, say in Hyannis, where we have a tobacco retailer on 3 out of 4 corners at one given intersection, and so this would eventually work towards eliminating that, and just so that people aren't constantly bombarded with tobacco advertisement and the products and that sort of thing.
So Bob, so I'm clear if I can, one of the 29 would have to be taking theirs up the street somewhere, and that would limit where they can actually relocate.
It would limit if they wanted to
new-
relocate, right?
Because there are no new permits, an existing permit.
Right,
Okay.
so the perfect example would be, for instance, where you just had one, a local retailer, right, on Old Townhouse Road.
Right.
That closed his business, and 2 doors down, right, in a strip, like a strip mall.
Yep.
There's another one. So if somebody wanted to come in and reoccupy that space and sell tobacco products, they would not be allowed to under that provision.
Right.
So even if the license was sold,
Right.
they still would not be able to use the building. They're
Correct.
just buying the license. Yeah.
Yeah.
That's clear.
So that's a simple example,
So
but
it's like
that's,
saturate, you're trying to,
right.
no saturation.
It's a density strategy to
Okay.
reduce the saturation of tobacco retailers in any given small area
Sure.
in town. So that's something the board might consider. Another is banning smoking bars, and I don't believe you have that. There are only, maybe like 21 or 22 in the state, most of which are in Worcester. But we do have one here on the Cape, and we do have some issues with them selling products and allowing customers to leave the establishment with them, which is against law. And so they're acting like a retailer selling, for instance, Newport cigarettes when no one else can. So it's contrary to the intent of the license that they have from the town of Barnstable and the Department of Revenue, the state. And there are other issues that we're dealing with as well with them. But a lot of towns are going ahead and just saying, no, we're not having any of those here in our town. So, I mean, they're obviously a unique sort of business. They have to be licensed by the Department of Revenue. They have to prove that at least 51% of their sales are derived from the sale of tobacco. The tobacco is supposed to be all consumed on site, which is problematic because who's going to go in and buy a pack of cigarettes and smoke the whole thing? It's impossible. But it's really intended for cigar smokers where they can go in and relax and have a cigar. But we have this wide spectrum of tobacco products now that people are using, including the vaping products, and they are the only establishments that are allowed to sell flavored nicotine delivery products in the state of Massachusetts, and so people are going in and doing that. But even if you buy a vaping cartridge, it's almost impossible to consume the whole thing in one sitting. And so what do people do? They have to take it out the door with them. So, and you also have the issue that the employees are being exposed to secondhand smoke, which is, of course, only legal in those establishments.
Why would this be relevant for us if we have a cap right now?
Well, because if you did have an available license, and one of these folks, if somebody wanted to come in and open one of these establishments, right, that would be available to them, right?
But if we have a cap, we're not,
If you're just reducing it, down to,
so we're not offering any more.
right. But if, let's say, a couple of businesses went out of, left, closed up shop.
Right.
And you'd have available permits, right?
I don't believe that's how we set it up.
So, okay,
So if it's
No.
lost, we drop down one.
okay.
No, they could sell it.
Look,
They
they
can
could sell, they could sell it to someone and they say, I'm going to open up a.
Right.
Right.
That's kind of
Right.
what I'm asking a little bit.
Yeah.
It's a different type of business. Yes, they can buy and have a license, but it's a different kind of shop. That would be up the Board of Health, I guess.
Right.
But they still would be required to hold a town tobacco
Right.
retail permit.
But this would proactively ban that,
Yes.
that type of business.
Possibility.
Make it
Right,
much
even
easier
the
for us.
possibility that they would even do that.
Right.
That's, so number 6 is ban smoking bars. So
I-
the hypothetical you just gave, not the hypothetical, what actually happened. Townhouse, they sold that, if they sold that to someone who wanted to put in a smoking bar.
Right.
Without this, they could have done it.
That's
You
Right.
would still be at 29,
Right.
but there would have been a smoking bar.
right.
I assume that, are we going to be voting on these tonight?
No,
I mean, is that
I-
the desire?
Mary, my envision as I'm hearing this discussion, I think it's going to have to be, this is going to take a couple meetings. The board will then up and down on a number of these different provisions. How many are there here? 17, maybe, Bob, maybe you have others as well. But at some point, we would reshuffle, edit this, and then there would be a hearing. The community and the 29 permit holders would be made aware of what those proposed regulations are, and then there would be a vote.
Right.
Right, that's what we
You would have
discussed.
to have a public hearing.
We
on
have to
it.
have a public hearing, exactly.
So
At least one, yeah.
if
for
you
sure.
decide on, even if you just decide you want to do one of these things, and you'd have to amend your regulations.
right.
We could have that done. We could have it drafted for you by our attorneys.
Yep.
And then you would have another meeting to discuss it and have a public hearing.
That's
and
what
then-
we talked about. But
Yeah.
tonight is the discussion, say, how do we bring these together, if any of these things they want to insert into the existing Yarmouth regulations?
Right. Okay.
Well, I definitely think that there are some we want to insert.
Okay.
Okay.
We should just go down the line, right, and just figure.
Yes.
So you have you already have number 7 in there, the minimum cigar package size and price.
Yes.
But number 8, yes, you have a blunt wrap ban, but there's a new definition that we've included in this regulation it's been reworded to include all of the products that there may have been some confusion about, such as Fronto Leaf and some of these hemp wraps that are out there that are flavored, and a lot of the retailers are selling these products. So they're used to roll not only tobacco but other materials, and basically they have flavored, a wide variety of flavors. They're cheap, and they're under state law, which bans flavor enhancers. They would be prohibited. So we recommend that you maybe rescind your current blunt wrap ban provision in this, and add the wording that we have provided here. Does everybody understand that one? Yeah.
Yes.
Okay,
Thank
so, and then the next one you have already, free distribution is prohibited. It's been on the books for over 20 years probably. And the same thing with number 10 and number
Coupons.
11.
Yep.
No redemption of coupons, no self-service displays. And 12, ban tobacco product sales in educational institutions. I'm sure you have that. And that's one that was, we had included these in the local youth access regulations quite a while ago, because at that time, some college campuses around the state were still selling tobacco products, including the kids could get them at Cape Cod, Community College. I know you probably don't have any college campuses here, but you never know. I think at one time, Bridgewater State was utilizing one of the local empty school buildings, or a school right over here, to teach some classes. So that would be covered under that. But I think it's already included in the regulation, but if it's not, it's an easy one to insert.
Okay.
And then the finding structure system under number 13, you've already done that, right? So you did the 1,000, 2,000, 5,000.
And we've had to exercise
Yeah.
several of those provisions that the board has.
Right.
Has exercised those several times.
So on 1,000, the first offense, I just want to make sure that the board was clear on what the suspension requirement is by the state, because it's worded kind of funny, and then the suspension for the first offense is mentioned in a different section of the state law than the suspensions for a second and third offense. So I don't know if you went ahead and adopted it, but it requires a 1 to 30-day suspension for a first offense, and we recommend 3 days for that. Unless you already have something that supersedes that in the local regulation and for a suspension on the first offense.
Bob, is that actually listed, the board, if I'm recalling correctly, we did $1,000, and I don't think the first had any suspension in there whatsoever.
Right, and so sometimes when folks look at the state law, they look at it and they don't see that there's supposed to be a suspension for a first offense, but there is.
Is it listed as it is?
Yeah, it's in a different
It's in a
section.
different, okay, because if you take that, if you take that portion of the penalty phase, it doesn't list the suspension in that first offense.
It's in a prior.
It's in a different
prior,
section?
section of the
Okay.
law, yeah.
All right, that would have to be adjusted.
Curiously, for the first offense, it's $1,000 and then a suspension of 1 to 30 days. But then the second offense is $2,000 and a suspension of 1 to 7 days.
Uh,
Why it's a lower number, I don't
Well,
know.
the board has, they did,
Yeah.
we've had, unfortunately, a situation has come up where $1,000 for the first offense,
Yeah.
and then $2,000 and a 7-day suspension. That has been done, but that first offense, that suspension that first offense did not include a suspension.
So that would be a change of,
That would be a change.
if we select the
Well,
3
it's actually,
days.
yeah, it's in there, but it's not in the right place. It's misplaced.
It's,
Yeah.
it's the way they did it, the legislature, I don't, and we don't know why.
Okay, yeah, of course.
So that might be something that you would want to entertain.
Anything else? Because then it go down to the 5,000, right? That's the upper limit.
Right.
We fortunately haven't had that, to experience that level of violation. And then what, rather than digging into it, what's the suspension number on that?
On the for the 5,000,
Thought you might have just known.
so, let's see,
I can find it if you,
that's right there, and 7 to 30 days. So,
okay. So there's discretion there. Yeah.
yeah, there is discretion. The reason they put in 7 to 30 is that, well, some local boards most local boards already have some sort of suspension for a third offense under the local regulations. Some are 7, some are 14.
Yeah.
Some are 30, So I would use whatever you have on hand in your local reg, as long as it's at least 7 days, so that you meet the minimum standards set forth in the state law.
Okay, so can I just give you a hypothetical here? So on number 2, it says, so let's say we had our third, a $5,000, the board, has to implement and rule and vote on a $5,000 fine and let's just say for sake of argument, a 7-day suspension. But if we go back into number 2, it says no permit renewal if they're a salesperson under 21-3.
Right.
So that would be the 5,003, and then they cannot, when that permit is done,
Done. At the end of the
they're
year.
over at the end of the year.
Right.
So if they adopt number 2, and the scenario becomes they have 3 sales, and they vote on that provision,
Yeah.
not only do they have the $5,000 fine, maybe a whatever number, 7-day suspension, and whatever's left in that calendar year, and then they're forfeiting their permit.
Right.
Okay. All right.
Okay. So then if the board chooses not to adopt that provision under number 2 there, the calendar resets, right? So what happens is at the time of each violation, you go back 3 years in time and you capture the number of violations that occurred during that period of time. Now, what happens with violators for illegal sales is that if they sell once, then we recheck them typically within 3 to 6 months, because we usually go to everybody once a year. and not always on the same date. So if we have a violation or two, we go back within 3 to 6 months, sometimes a little sooner, sometimes depending on, a number of factors, it might be a little more than 6 months. But within that recommended time frame. If they sell again, then they remain on the list, and they get checked again and again and again until the behavior stops, or the activity stops, if you will.
Okay.
So, hopefully, the recent actions that have been taken on the retailers that have been in violation here in Yarmouth will correct the problem, and we can move forward. And, we never take any satisfaction or pleasure in catching anybody. My perfect day is to go out and check, 30 stores here in Yarmouth and have 0 sales, because then we know everybody's on board, and we try to make the retailers feel like, we have tried to develop some partnership with them so that everybody has some responsibility in keeping the tobacco away from the young people.
It is, Bob, the board is put in a difficult situation. It's hard to, when you hear the stories, and I'm sure you've heard them as well.
I've heard them all.
It's hard to be cohesive when the board is, ruling a $2,000 fine against someone and say, listen, we're in this together. And, that's direct dollars we're working on such a small margin. There's some really heartfelt stories that happen here, and
I know.
it's difficult.
Yeah, I know. I work
Yeah.
with, 20-something times. So, but it's reflective of the hard line that the state is
Yeah.
taking.
No, I get it.
On illegal sales.
Right.
Yeah.
Yeah.
Boy, I
And the
don't,
flavored products.
yeah, I just don't like hearing at our discretion. It makes it difficult. Everybody should get the same suspension, the same
Right.
fine, and it makes it.
Well, the suspension piece is, the only discretionary piece for the board.
Right.
Limited discretion, because they give you a guideline, right? So, for instance, for the first sale, it's got to be 1 to 30. So we say 3 days. 3 days. Should always start on a Friday. But again, that's up to the board how you want to do it. And 7 days for the second one, and then 7 to 30 for, or 1 to 7 for a second, and then 7 to 30 for a third. Again, if your regulations already contain longer suspension period, then that's what you have to go by. Okay. I think you might have 30 days in yours for a third offense, right?
I believe there is.
I think it is. Yeah.
So,
So.
Fortunately, we haven't had to do that, not since
Right.
I've been
Hopefully
here.
you won't have to.
Yep.
Hopefully you won't have to.
Okay.
Okay. And then so we've kind of covered 15 and 16 here. So on number 17, I believe in your, for the suspension piece, the state law, says may in some cases. It goes back and forth, but it should always say shall, so that you, as a local board, don't set any regrettable precedents by saying, oh, well, we're not going to suspend you, but then the next time around, someone comes in with the same offense and you're giving them 7 days or 3 days or whatever it is. It should be just very clear
So,
as to what the penalty is.
so 17, so you're saying to insert the word shall as opposed to may, there's no ambiguity,
Right.
There's no, okay,
Use the word shall instead of may. Exactly.
okay.
Yeah. So those few policy decisions are the ones that the board might consider adopting or integrating into the local regulation. I'll get you the clear definition of the dual cap, because I don't want to give you any misinformation on that. But if you have any other questions about the things that we've talked about, I'm happy to discuss those, or if you have any other questions in general about what's going on in the tobacco control world.
you aware of any Yarmouth restrictions that are greater than the state?
No. Well, you do. Well, you do have some things that, see, for instance, all of these are not included in the state law, right? So the local, for instance, blunt wraps, right? The state doesn't prohibit the sale of blunt wraps. Yarmouth does.
Right.
But in this case, this is a draft model regulation that has been drawn up by our attorneys for boards that want to either adopt blunt wrap ban, or if you already have it on hand, to change the language that
Okay.
we're suggesting to
great.
capture, again, a wide range of products that are out there now. Some of which argue that they're not blunt wraps, so,
Right.
yeah.
No, I appreciate customizing
Under
it a
the
little bit.
previous according to the previous language. Well, and so a lot of these, I mean, mostly for the state, as far as the state law goes, it primarily just the enforcement piece, you know, the fine structure and the suspensions. The rest of it is local stuff,
Okay.
you know, things that you have. So, and most of which, again, you already do have, but a few things that you might want to consider.
Okay.
Density strategies, again, the blunt wraps, the smoking bar piece, those things, and the dual cap, whatever. You already have a cap, so I don't know if you would be interested in changing it or not, but I will provide the language for a clear definition of what the dual cap is to Jay, and then he can share it with you guys.
Okay.
Okay.
So,
Bob, if we do accept
Yes.
some of these policies, you said your attorneys would help us write the verbiage language.
They'll do the whole reg, yeah, they'll do it, and then you can just take it, look at it, request any changes, or accept it, and then, you know, offer a vote, call for a vote on it, if you so chose to. Yeah,
And they would use as a basis our existing reg.
yes,
Yeah, okay.
yeah.
Sounds good.
okay.
Yeah.
I think you've given the board a lot to think about. I don't know if, Chairman, if you're going to take a vote tonight, maybe you want to look this over at the next meeting vote, or what those regulations are. There's a lot to think about here.
Mary, Eric? Dr.
I don't think
Denizia?
there's a whole lot to think about, frankly.
I don't either.
No?
Well, Mr. Chair, if I might suggest, so what some of the other boards have done recently is to have a discussion about which provisions you might want to include in your local regulation or amend the local regulation with, and then we could have the regulation drawn up for you, and then the next time around, you have the discussion or a public hearing or whatever. Have the discussion and then a public hearing after that,
Okay.
if you'd like to go that route.
It looks as if there's 7 out of the 17 by my calculation.
So that you'd want to adopt, Mary?
That we don't have already.
Right.
And yes, I mean, I'm happy to adopt any of the ones that have been suggested that we don't have.
I feel the same way.
Yeah, I agree with that. But the only question I have is why is Yarmouth different than state regulations? Why would there be a difference?
Well, may I?
Yeah, sure.
Thank you. So the way the tobacco control works is like, you know, so many other public health areas, we have home rule here, right, in Massachusetts. So these decisions are typically left up to the local municipalities as to how they want to do things. So we have the tobacco control program that's been in existence since 1993. And we provide technical assistance and enforcement, you know, assistance, all of that. And so the local municipalities, boards of health, have adopted the regulations that we've suggested based on, you know, the information that we have and what new products that come on the market and, you know, what works and what doesn't and so forth. So they're all evidence-based and legally sound. The state always has regulations that are typically not as strong. They don't cover as many areas as the local regulations do in most cases. So you know, for instance, I just pointed out a few things that the state doesn't, you know, cover, but they did pass a law in 2019 that became effective in early, January 1st of 2020. Some of it did, and then again on June 1st, another portion of it went into effect. Whereby the enforcement piece is far stronger than what any municipality had on the books. So it's not only advisable, but some would argue illegal for local regulations not to at least meet the statewide minimum standard for any law. So that's why we're here. Again, several of the towns have adopted this language. Eastham, Falmouth, Plymouth just did this, Harwich just did this, Bourne and Wareham are working on it as we speak. And Sandwich is also working on it. And if I'd mentioned Falmouth has already done it. So, it's in motion in a lot of places. And we're just trying to upgrade because, when you're dealing with an industry like the tobacco industry, it's like playing a game of whack-a-mole, at the carnival. Every time you do something to counteract what they're doing, trying to addict our young people, they come up with something new, and it's a game of endless resources for them, and then we have to play catch-up, and so this is why we're here.
And I just want to add too that I think another rationale for it is that the more consistent we can all be, then that is really the fairer it is to the retailers, because they will say when we come up with something that's maybe a little bit more strict than a neighboring community, well, people are just going to go next door then and get, buy in the manner that, we have now forbidden. So I would think that it would be something that would be more palatable to the retailers also if we could all be more consistent in our regulations.
Some of the owners have stores in different towns also. With
Absolutely,
different
yes.
regs. It gets
Makes it
complicated.
more
Yeah.
complicated. Yep.
We do aspire to a level playing field, but everybody kind of moves at their own pace. So, but these are the latest recommendations. Again, all evidence-based, legally sound, and highly recommended. So, for clarity, though, I know Mary had suggested, the 7 pieces. Maybe you could identify those specifically, Mary.
Yes.
The ones that you're, willing to move forward with, so the other board members maybe could agree or disagree at this point, and then go from there.
Number 2, we do not have that stipulation about no permit renewal if 3 sales to persons under 21 within the 3-year period. The next one that we do not have is specifying the distance between permittees. The next one that we do not have is we don't specifically ban smoking bars. Then we also need to add the new definition of blunt wraps and rescind our current definition and insert the new definition that's more broad. And then the finding structure, need to clarify the first offense, that it's a 1 to 30 day suspension, and you are recommending 3 days and starting Friday. The next one is, it's the suspension periods that I mentioned. And then the last one that I've noted anyway is that we need to always say shall rather than may anywhere that we have, specifically in the suspension language.
Okay, so that's 2, 6. That sounds
7.
So if I could just run down that list that's number 2, number
Yes.
5, number
Yes.
6,
Yes.
8,
Yep.
13, 15, and 17.
12. I'm sorry. 13. That's the
That's what I said.
findings.
Number 13, right? I said 13,
Yeah,
8,
clarify
13,
it.
yep, 15, and 17.
Yes.
Okay.
Number 12
That's fine.
also? Do we have that one in there?
I had a question
We
because
do have Bridgewater State right across the street.
I think that's
right.
already-
Okay.
already
So
in
we
the
need to do it
okay.
specifically. Yes. Yes. I had a question mark because I wasn't sure what we were dealing with there. Okay. So yes, that one needs to be addressed, I believe.
Okay.
So Jay, do we need to vote on this right now in order to pass this on to Bob to go to work on it?
You would. You would need to vote on this. Yep,
Oh, yeah.
yep. Then there would be a public hearing.
Yeah.
We'll put
That
that
would
back.
facilitate things a little bit.
Yeah.
We can see what happens if someone wants to make a motion, see how we do on it.
I move that we adopt the 8 specific pieces that will change our regulation. And that we, for number 5, that we say no new permits within 1,000 feet of existing permittees. Or let's say 2,000 feet, what the heck? Because that's the one that we had to specify.
Second.
Do we need to specify days here also, if you're looking towards 16 and all? Make that decision
Suspension periods,
tonight,
yes.
Mary, or not? Yes?
Well, that's, I guess, the first violation, I'm fine with saying recommended 3 days, and the second and third, though, are where we have some discretion.
How do you feel, I know you're still making the motion of not doing discretionary, but picking out a number of days?
For the second violation, up to 7 days, you mean saying,
Pick a number of days, in the same way we have 3 days for the first offense.
I'll say 7 days. And for the third offense, 30 days.
Okay, all right, that's just for the motion, so that's fine. Thank you, okay. Motion makes sense? Does not.
What's the purpose of the new permits within a certain number of feet? What would be the purpose of that ruling? Just, is it obvious? This is number 5.
Right. I think Bob said so that there wouldn't be a congregation of smoking businesses in one area. He gave us an example in Hyannis. There's an intersection where 3 of the 4 corners have smoking establishments. It cuts down on the advertising and the accessibility that we are trying to address by our cap.
The density of stores selling tobacco,
see.
essentially, is trying
Right.
to prevent that. So Mary was
So
suggesting,
would that open the town up to like a potential lawsuit, do you think? I mean,
Bob said these are all legal.
pardon?
Bob said these are all legal. Bob, are you still there?
Yes, I'm here.
So is that,
Yeah, they're
Stood-
all legally sound strategies.
would it be helpful for us to, it would be helpful.
Yes, please.
Mary, I appreciate the motion, maybe we can just go through it again.
okay.
I guess it's, well, I don't have to speak for you, okay.
Okay, I move that we insert the 8 recommendations for changing our regulation. The first is the no permit renewal of 3 sales to persons under 21 over a 3-year period. The second would be no permits within 2,000 feet of an existing permittee. The third would be to ban smoking bars. The fourth would be to ban blunt wraps and using a current new definition to replace the one that is in our regulation now. The next one would be to ban tobacco product sales in educational institutions. The next one would be related to the fining structure. The first offense would be a 1 to 30 day, a 1,000 fine, 1 to 30 day suspension with a recommendation of 3 days, starting on Friday. The second would be 7 days, and the third would be 30 days. Which actually went on then to number 15 and 16. And then the last is to put shall, replace may with shall in the suspension regulation.
That start on Friday would be for the second and third, I assume, offense.
Yes,
Yeah.
yes.
Great. That's well done, Mary. Thank you.
Thank you.
There's second to the motion?
Eric did.
Eric, thank you.
Second.
Discussion? Anything? Anyone? If not, we're going to vote. So, all in favor of the motion, raise your hand, say aye. Aye.
Aye.
Unanimous?
Aye.
Okay, done.
Thank you very much, Mr. Chair, members of the board. I'll have this drafted for you, and we'll forward it to Jay, and then,
We're not at our old new business, but there's a good possibility our next meeting is September 18th. Okay?
okay, sounds good.
I think we cover, just, it may be redundant when you're trying to insert these new things. I'm just looking up the Yarmouth, and I know you alluded to it, that we have that Yarmouth has the board, no person or entity shall sell or distribute blunt wraps in Yarmouth. So does that cover this, or is this something new?
No, the new language would be in the draft model that I
Draft model,
that I
terrific. So
provided to-
it's not being redundant.
No, so you would rescind that
We'll
section.
pull this
and-
out and put your
Yeah.
new language in.
Right.
Beautiful. Okay.
Okay. All right, thank you.
Thanks for coming in, Bob. Thank you.
Thank you, Bob.
That was very helpful. See you. Oh, good to see you. Thanks. We'll be in touch.
Jay, can we go back to the agenda number 3 or 4, either of them, or not?
This is number 3. Oh, I apologize. Restrictions, that was number 4 that we did, so this is now we're going to number 3.
No, that was 5.
Oh.
That
No.
was 5. This
No,
is number
there-
4.
It's
Number
five.
5 was
We did number
tobacco.
five.
Now, this is number
4 is
4.
plastics, and 3 is Yarmouth Food Pantry.
It's
Maybe,
enclosures.
maybe I'm not
That's
being clear.
These are enclosures, you have it differently.
I
Okay,
forgot.
I apologize. I was reading off enclosures.
No, no big deal. So are we able to do either of these right now?
Do that right now.
Okay, and which one are we, I assume it's number 4?
Yes. Yes, it is. This is, and I apologize if I'm saying this, the name, Mahadvi? Mahadvi.
Lee?
And Haley, yes, Haley, welcome back. You were here before. If the board remembers, and the community listening may remember, back at the town meeting on, I believe it was April 25th, what passed, 2 of the articles, Article 34 and Article 35, and it was banning the use of plastic products in restaurants and single-use plastic water bottles. It was at the very end of the meeting. This would be an opportunity for the board, because there's a strong intersection between the Board of Health and both of these initiatives, that the board would have an understanding of what the purpose, the public health and environmental impact are, and the intention is, and where the probably enforcement may lie. So if I could turn that over to Mahadvi, and you could go ahead and do that.
Yes, thank you very much. I'm here on invitation by Haley O'Neill, who was the petitioner for the articles that passed at the Yarmouth Town meeting. As many of you are aware, plastics are a very ubiquitous issue. The biggest issue, though, most of us don't really think about, is this product has not been around very long. So scientific research with regard to degradation and even human health impacts is very limited, because we are living through the living example and the basic petri dish version of what future generations are going to be dealing with. So I'm just going to give a general overview. It's fairly basic, and the primary reason for it being basic is I think it's always easy to be complicated. But hopefully, by being basic, I can incorporate information that may be useful to the layperson who may not necessarily be as cognizant of the issues that they deal with when it comes to plastic. So this particular graphic, just shows that there are so many different substitutes. For those of us of a certain age, though, we do know that we grew up without plastics, and I am of that certain age, And there were no plastic bags, there were no plastic water bottles, there were no plastic diapers. All of these things are convenience items that were created, and that's one thing I think is very important. A lot of times people talk about science, but the most important aspect of discussion is really economics. We live in a consumer and producer-based economy, which means that we are speed to market and marketed demand. We are not demanding a certain type of product and therefore supply provides it. That market existed a long time ago. So I'm speaking to you as an economist, and oftentimes people always talk about economics in terms of only the dollar value. The part that's missing is the value we are not paying for, the externalities. Those are the values that we pay for in our health long term, both in terms of human health, but environmental health. Those are not captured in the price of anything that we're purchasing because we wait for regulations to come along to tell us that we can't do what our conscience typically tells us we know we can't. It's really important to think about it. I teach economics, I'm a professor of economics, but the most important aspect here that's really, I cannot say this often enough, is we live in a system where the conscience of what we put out in the market is not the dictator of what we put out in the market. It's the desire to get people to buy it. So I hope, especially in talking to the Board of Health, you'll take that into consideration as we continue to go forward. We created this particular infographic a while back, and I'm just going to use this as a means of discussion with you today. Every product, from the blouse that I'm wearing to this table that's here to the microphone, has a life cycle. Every single thing has a life cycle. Typically, though, we only think in terms of the consumption life. What we pay for is the time that we're going to consume something. But we have a sort of a myopic perspective. We don't think about what it took to create the product and the life that that product has after we no longer use it or we discard it. The extraction, production, consumption, disposal, and all the attributes that occur at disposal need to be considered. Unfortunately, they are not in prices. So as an economist, I'm going to say this. I hope that people listening will remember this. Prices are not indicative of the true value of anything. Anybody who's been underpaid can say that for sure. But you can also say that for almost every product we consume. We are subsidized by the environment and the health and well-being of other creatures and vulnerable populations. So this particular slide goes through those basic elements of what we consider to be a life cycle. So I'm just going to spend a minute on extraction. And this is just going to touch very high level on two aspects of plastic. Most people are familiar with standard plastics, which are a petroleum-based product. So they're coming out of fossil fuels, which are a non-renewable asset, which means just by the very factor that they are not renewable within our lifetime and even a multiple lifetimes, the price of petroleum should be significantly higher than it is. Prices should be indicative of the supply and regeneration capability. So this tells you a perfect example of how we underprice resources. The other thing that's happening is you're seeing an increase in so-called bioplastics, as though somehow that's a great solution to our problem. It's not. I'll give you a very simple aspect of it here. We are in a global water shortage. We are running out of water. When you switch to bioplastics for a one-use product that will have a very short consumption life and a very long disposal life, where that water is actually useful to create food and also provide beverage for people's life sustenance, it's a very poor use of that resource, just from a very basic level. But also when you start to think about bioplastics, and I'm just going to say this this one little stat that you should all probably look into, they also contain synthetic estrogens, just like petroleum-based products. Synthetic estrogens are much more impactful to men because men do produce some amount of estrogen, but as you know, they have predominantly testosterone. So the secondary sex characteristics are increasing. There is evidence of this in terms of men who have eaten and ingested plastic from a variety of sources, specifically fast food type sources or other types of sources where the food is heated and the food therefore absorbs the plastic leachate. Most of this research is emerging, and I would suggest if you would like, we'll be happy to send you any papers that are out there, but it is emerging, especially with the bioplastics in terms of the toxicity there. The primary reason why you don't see as much research in these areas is who is going to fund it. It's the same thing with big tobacco, who just spoke a moment ago. How long did it take us to control tobacco in this country? I'll use the same lines that the gentleman before me said. These are big industries that have much more deep pockets that can counter any statement. And also, most people don't want to believe that they're ingesting things that are unhealthy for them. So it makes it convenient when somebody comes out with a counter report that says it's not unhealthy. So production phase, there's a great film. I would really recommend anybody who can watch it, watch it. We actually shared the film because Sustainable Practices, the organization that Haley and I are a part of, have a film series, and that's out of the Chatham Orpheum Theater. The film is called Tapped, and Tapped actually deals with aspects of the production of the products that go into plastic. And this specifically looks at Cancer Alley and also around Corpus Christi, Texas, at the heightened levels of cancer and different types of cancer, and also the mortality variations in these areas. So that in terms of human health, we know that that's the case. We also know that there's issues with regard to plastic pellet creation, and aquatic life. These are emerging issues. We don't know the bioaccumulation impacts. We don't know exactly how the leachate is going to affect, but we do know that now plastic has shown up in the bloodstreams of many individuals. It has also been shown to cross the placenta. So this is an issue that I think people should be aware of. I don't know how long it will take science to tell us that something is harmful to us, but as a Board of Health and just in general as an individual, we have to think to ourselves, what is the risk we're willing to tolerate that something may be bad for us? So at consumption, plastics leach into the food substances we consume. I was looking at Williams Sonoma yesterday because I was going to buy some new dishwashing detergent, for hand washing detergent and detergents, and they have specifically started to note that they are phthalate free, just to show that people are becoming more aware of the adverse consequences of ingesting and also accidentally getting into higher contact with phthalates. But they also went on to talk about BPA free. In the United States, we only regulate BPA for products for infants and toddlers. We have not done a more precautionary process of eliminating BPAs for any kind of product. So this is telling you that even though the government is not mandating this on a larger level, companies are becoming aware that consumers are aware of this. And another aspect of this that I just put out there for any consumer, if you're looking at a publicly traded company, say like Coca-Cola, for example. Coca-Cola, like every company out there, has to have a risk disclosure in its 10K, its annual report. And in that, you will see that it looks at emerging risks, changing behaviors of the American public, as well as also looks at obesity issues related to its product as being a risk, because as our diet changes, that will be, but our changing perceptions towards plastic are a risk to these companies. So the very companies like the Massachusetts Beverage Association or any other beverage association, large water manufacturers, cola manufacturers, anybody who's bottling in plastic is of course going to tell you that it's safe, but if you look at their risk disclosure, which is where they're talking to their investors as to what could potentially adversely impact their bottom line, they are disclosing that they do recognize this as a risk. So here, just in terms of the exposure can occur in many different ways, and this is a very simple example of the types of impacts of microplastic in humans. We've seen studies that basically say that cardiovascular disease, endocrine disruption, autoimmune disease, fertility issues, obesity. Some studies have tied even ADHD to plastic consumption. So at disposal, the disposal of plastic in general is just toxic. There are three main mechanisms of disposal: landfills, incineration, and then recycling. Landfills, I just want to ask you a question because I bring this up in my class. I just finished teaching my economics of sustainability class last week. And one aspect that I brought up with my students is it makes sense to put things in a landfill if it's biodegradable, if it's an organic item. We know plastic is non-organic. We also know it's not biodegradable. We also know the majority of the products that we consume are not biodegradable. Yet, we continue to put things under the ground where we can't see the harm that they're creating. I really hope that you will think about this too, because it's not just the plastic, it's thinking with some common sense as to what we are doing to the earth. What kind of products we create, without even thinking about the disposal impact of it longer term. Incineration even further masks this issue by helping us breathe it in. So, unlike a coal-fired steam plant where you know the two outputs are nitrogen oxide and sulfur dioxide, so you can put a scrubber unit on it, the mix of trash is impossible to know in terms of what the emissions will be. We are now burning this product and burning other things, which then only come back to us in the form of smog and other types of adverse health consequences. And it's invisible. That's the part that's really frightening. Now, recycling is positive if the product was actually designed to be recycled. Plastics were not designed to be recycled. There are a couple of basic things to take into consideration. Every vendor has a different density of plastic. There are different colors of plastic. On top of that, virgin plastic is required in order to re-engage the bonds of plastic that's been broken down. So you continue to perpetuate this, and then unfortunately, it's never recycled into the same product, so it's not a closed loop. I have stretch in my jeans, and that's because plastic is in it. So plastic adds to the obesity problem and then allows us to wear the same size by giving us jeans that stretch. It's an irony here. But recycling, in the end, products are then eventually downcycled, or they finally will end up in a landfill at some point. Otherwise, they will be incinerated. The interesting aspect of landfills, which hopefully most people will be knowledgeable about, is that landfills do get water in them, and they are pumped so that the water is removed. Oftentimes, that pumped water is going to be highly toxic. Sometimes it's taken to wastewater facilities, but most of the time it ends up being pushed into the ocean, which is yet another way that we take human pollution and then use it to harm animals that we cannot see. So our goal, fundamentally, we're starting very small. We're looking at just saying no to single-use plastics, taking us back 40 years, recognizing that we've made a mistake by pushing this product out too quickly without really completely understanding it, but also perhaps making people think about every product they consume. We have exported our consumer economy globally, which is why we're accelerating the amount of resource use at an ever-growing rate. And I wish I had more to talk about, and or not more time to talk. I have many things to talk about. I wish I had more time to share with you, because I feel very passionate about this issue from the standpoint that if you can connect the dots for most people, they will understand. But we have to make it easy for people, unfortunately, too. People are so busy with their day-to-day lives of just trying to live that they don't always have time to think about how the things that they're buying may be actually affecting their long-term life quality. So one thing we have to focus on is what little decisions can we make that actually help enhance people's life experience. Plastics is one of them. But then on top of it, how can we also use this as an educational platform to get them to start thinking life cycles with regard to everything that they consume? It ultimately will change our economy, and I'm sure many people have heard. We are needing a paradigm shift today. And this is the aspect of the paradigm shift we're talking about. We would all be so much more wealthy if we weren't connected to being a consumer as much as we have been promoted to be. So I'm going to stop here, but that's basically what both the bottle ban, the commercial single-use water bottle ban, which was passed that night, and the single-use takeout ban are about. They're about eliminating aspects of products that we blindly trust are okay and healthy for us to consume when they're not. It's not a bottled water is not highly regulated compared to municipal water. And single-use plastic containers definitely are leaching chemicals into the food people are eating, and on top of that, cannot be disposed of effectively. So we hope any comments or questions you have, or any other aspects that perhaps we can magnify, we'd be happy to do so. Thank you.
I really appreciate that discussion. What are your suggestions to replace these plastics as far as, I mean, we've got to offer the consumer something, or they're going to be a tough sell.
Well, I'm going to first start off by saying we got to offer the citizens something. I think the first problem we have is that we start to refer to ourselves as consumers. And fundamentally, we are citizens and community members that happen to consume. I think we have to focus on reuse. And it's refuse, reduce, reuse. Refuse the concept of convenience and be inconvenienced so you're actually paying the true cost of consuming something by taking the action it takes. A simple example, we use an awful lot of water, right? So part of this problem is the humans, we used to have to carry our water, even in this country, 3 to 5 gallons was a normal usage level. But with pipes, the concept of thinking about getting water to people was probably more the focal area than thinking about making sure that we also conserve at the same time. So now we can consume indefinite amounts of water, but we're not thinking about the impact of that water. So here, this very similar type of analogy that we have with plastic. We have this product that's come out we're overusing and it's underpriced. So we have to go back to carrying our load, that 3 to 5 gallons of water. We have to go back to, in my opinion, carrying your reusable bottle wherever you go, but not having 100 reusable bottles, just maybe 1 or 2, because that otherwise defeats the purpose as well. So reuse. Thank you.
What about things that, other than water, for example, say somebody wants, say, seltzer for their drink or something like that? I mean,
Well,
people are going to still want to buy.
Well, the products are available in aluminum cans, and aluminum is actually a much more effective product to recycle. It's really amazing, however, though, the plastics lobby have been so strong that you'll find lots of receptacles for plastic recycling, but nothing for aluminum recycling if you look around. And that would be what I would actually advocate for if you have to have a single use. But you have to remember that even those aluminum cans have a single, very thin plastic lining inside them. So you'd want to make those plastic linings BPA free, at least reduce the amount of toxicity. Because when you have a product that has a little bit of acidity to it, it will have an issue with that plastic lining on that can too. So I think we have to start making our citizens, fellow citizens, more aware of the potential harm of the products they're consuming.
So are there already provisions for recycling aluminum?
Oh, definitely, yes.
Okay, I mean, I know we recycle them, but I don't know what happens to them after they go to.
They can actually be made back into a aluminum can.
Is that what happens to them now?
I'm assuming it does, sir. I can't say that any more than I could say about plastic bottles, but we do have more data points when it comes to plastic because of the fact that it is such a charged issue.
What about glass?
Glass is fine, but it would be best with glass would be what my family did when I first moved to this country. We got our deposit. We paid a deposit, excuse me. We consumed, we brought it back, we got our deposit back. The best thing for glass is reuse. The only other alternative would be if you had one standard type of glass, which is what they're trying to experiment with in Oregon right now, a standard container. The only thing that changes is the label. Then, it'd be even easier because that way you could have the same bottle. People just change out the label for the product. Any vendor could pick it up. But it's very possible that could happen. It's just a matter of believing that it can happen.
How do you see the cost for citizens? In other words, if you're going to have a
EPA?
BPA product that may cost quite a bit more, how do you see that? May not be that progressive in the sense of expense for individuals and who can afford these products, which there are a lot.
So there are two things here. One is you are going to pay for those products eventually with your health and those of your family or other people in your community because those products will leach and harm the environment as well as people. They may harm the people in the vicinity where those products are manufactured, but we are one nation, and I always I'm really hoping that we have some compassion to our fellow Americans in other areas of this country as well. There is a cost. It's just that you're not paying it at the moment. You're paying it indefinitely into the future. So that's number one. But the other aspect of of that in terms of looking at the cost of these things. Most of them are not necessarily more expensive. It's a question of being challenged to make the change, you know. So if you know that a BPA, that bisphenol A has adverse consequences to your health, why would you want to consume it? It's very much akin to the idea of the tobacco discussion you had before we joined. I mean, people know that things are bad for them, and they consume it. But in their consumption of it, they're actually harming others. The question is, do they have a right to have that freedom of choice that when it leads to a larger community, national issue? So,
I mean, your presentation is very clear. It's great. Part of me thinks that it should be at elementary school age people and not the people who are at this table here.
unfortunately, you are the ones that vote. They don't. They only influence their parents. So, I mean, we started off a long time ago. We started in 2019, and yes, I did speak at Nauset Middle School, Nauset High School, Dennis Yarmouth. I've been to Monomoy as well.
Great.
It's really the teachers that need to be applauded, though, because they're the ones that invite us. Because they understand that this is an issue that these young people will have to contend with, and they also understand that their parents are influenced by them. So the biggest issue we face is with adults not wanting to change, believing it's their individual choice to do whatever they want without recognizing how products actually get on the market. We never wanted a cell phone. When I was growing up, I never thought about a cell phone. Now we can't live without them. Did we demand them? No. We were marketed them until we could not live without them. That is true for almost every product we consume. We have to get people to take control. And we can get back the market, and we can demand the quality that we deserve to have rather than the profits that somebody else thinks they can have.
Yeah, once again, you look at the tobacco for the 60-year project we're still working on, dealing with it. The students that you presented to are going to be the adults who are still at this and trying to improve the environment and our health. That's the only point I'm making. That
Tobacco wasn't eliminated, sir. We are eliminating these single-use products. That's why this will be more.
I missed the last.
These single-use products will be eliminated with these bans, with these articles. So the thing that's important here is that reason why this will be a success long-term is because we're looking at the elimination. Tobacco, unfortunately, wasn't. So they looked at making other types of products that were not regulated, like cigarettes, so they could continue to make their revenue. We're hoping that we can educate the public and eliminate the single use. The issue that I think also needs to focus on here is that Yarmouth and Harwich were the two towns that did vote on this and passed it, which need to be applauded in that regard. We do believe that Falmouth, Provincetown, Eastham, and Brewster will be following suit very shortly. But your vote and your perception on this issue is very important for the general public. So thank you.
And I'll just push, just for us, in sense of Yarmouth, we were out in front of the state in sense of restrictions on tobacco, I must say. So hopefully we'll be doing the same with plastics.
I hope so.
Board members, questions, comments?
Could I just ask, enforcement, is not we're trying to change behavior. Sometimes there has to be an enforcement component. Is that spelled out, and where do you see that?
The enforcement occurs, first of all, the enforcement both for the commercial ban and for the plastic takeout or plastic reduction article are the exact same. All of our articles, going back to a point that I believe Mary made with regard to the last article, are the standard language for every single town. So we're filing this, everything we do, we file across all 15 towns. Standard language is really important. What we've done is, depending upon it's a town manager or a town administrator, that language states that it's under their purview as to who they're going to use as the enforcement vehicle. In some towns, it could be the town board of health. In some towns, such as in Brewster, it is the actual assistant director, the assistant town manager. And that's because Brewster has so few retail establishments. So it's up to you to determine that in terms of your own town government. We don't want to have that oversight. But the enforcement in terms of fines, the state limits the fine to $300. So the first fine is $300, but the first fine is a warning, second fine is $300, but the fines accumulate daily. So if you were to go someplace and they were out of compliance, and you go back 10 days later, they can pay, they will be liable for those entire 10 days for that $300 fine. But it's spelled out in the article itself. So
Education and engagement is going to be an important, right? This is a campaign. This is an educational campaign. Have you spoken to the business community?
the business community is very challenged with regard to this. We have spoken to the business community in the Chamber of Commerce. Haley spoke to the Chamber of Commerce here in Yarmouth and can speak to that issue specifically. But each town is different. So it just depends on the town and the community, and also depends on how educated the person who's in that leadership position is with regard to the future and being out in front. What we are doing here has an opportunity to make the Cape actually a even better destination. Why do people talk about Costa Rica? It's because of the ecotourist platform that they were early adopters of. Ecotourism means that we show that we hold where we live to be at a certain standard, and we ask those that come and visit our home to hold that same standard. And then they become ambassadors of that standard to where they live. And that's how we can be conduits of a change that needs to be made. The change has to happen in the United States. We are the primary consumers of these products, and we have pushed these products out worldwide. We have to take a leadership on this issue, and unfortunately, we haven't. So change has to be local, and then it has to be diffused locally. And we're hoping that that will be the case.
In implementation, when does this take effect?
In Yarmouth, it takes effect January 1st, 2025.
The bottle ban takes effect this December 31st, 2023. So,
The takeout ban was 2025, January 1.
yeah.
Takeout ban,
So one of the big issues was inventory, and we were concerned about that for the owners of the stores, and so they've hopefully had enough time to move the stuff out. you
Yeah.
know.
It'll be in the winter, so it'll be on the off season for restaurants, and it's not till 2025, so they have some time, and hopefully there'll be better reusable options before that goes into effect.
What are your thoughts on just the additional expense to the store owners and what the prices for the customers will be? What are your thoughts on that?
The prices are incremental at best. We are a tourist destination where a 10-cent increase is not going to turn a tourist away from a dinner. There have been numerous studies that have proven this, and it's what basically economists refer to as elasticity. And the more price sensitive a consumer is, the greater the chance that you're going to lose them. But usually on a 10-cent or 20-cent increase, it's not going to be effective. The other thing to take into consideration, the ban does take and eliminate single-use cutlery, which is a cost center for retailers. What they could easily do is buy reusable cutlery, which is coming out in so many different ways these days. It even has a napkin that rolls around it. They could sell it to people to try to get them to start carrying their own reusables. So they could take a cost center and make it into a revenue generator as well. The other thing, I really can't stress this enough. When we go to a restaurant to buy food, we are not going there thinking that we have to be wary that something we consume there is going to be harmful to us. So there is a certain duty of care that restaurants have to their patrons. They should be researching whether the containers that they provide the food in are safe, shouldn't they? So it's not just amount of the money that they have in inventory, but their duty of care to the people that they're providing food to. I think we need to be focused on that part as well.
Okay. Presentation was very clear. It was great. Thank you. Anyone else? Comments? Nope.
Is the single-use the bottle ban, is that just water, or is that,
Yeah, just water.
can I ask why we decided just water and not soda?
We
I'd
started
rather
this.
have my daughter drink water than soda.
Well, water can be purchased in aluminum cans as well. So aluminum cans are available for water, but your daughter could also use a reusable bottle. We picked water because there was a learning curve associated with just this whole plastics issue. We started this in late 2018, with a municipal plastic bottle ban, which eliminates all town purchases of single-use plastic bottle beverages and the sale of beverages the sale of beverages in single-use plastic containers on town property. Yarmouth did pass. All 15 towns have this article in effect. But that was a big learning curve for people because the bottled water, people didn't recognize that this had an issue in terms of just the plastic leachate. People keep it in their car, the plastic expands and contracts, the leachate has a higher probability of going into the water. But the other reason was it's substitutable, because the first question we have is, what am I supposed to do if I can't buy this, right? Well, you have municipal water sources. Municipal water, based on the EPA guidelines, your state, and on the local level, municipal water is checked relatively regularly. I think in a town of Yarmouth size, at least some place it's being tested once a day, which means that you are having to be in compliance with the Safe Drinking Water Act. The FDA has regulation over bottled water. They do not test it. They only use manufacturers' testing data to determine whether that water in that bottle is safe. And they test less than 2% of that water. If you were just to do a simple search, you could find different water bottles that have been pulled or have been noted to have arsenic recently in New Hampshire in the water, but they didn't have to pull it off the shelves. So this is yet another really interesting aspect of this. Bottled water, it's 60% of the beverage market, plastic beverage market. It's substitutable with tap water, and your community water, you know what's in it. And your community water is your responsibility to protect. You have direct contact with it. So this is another way that we could also use it as a means to get people to be connected to their community resources, because we are the protection of what we consume in our own communities, aren't we? So that was the reason why we started with bottled water. Coca-Cola and all these other products, they're actually on the decline. That's why Dasani and Aquafina exist, because the bottled water industry is the biggest booming section of the beverage market, because people's desire to get off sugar and be more health conscious. But the other aspect of those is that you can't substitute with them. We only have a can, and those cans already exist. So it's a question of educating people that they shouldn't buy it out of plastic. If they want to drink it, buy it out of the can that's already available to them. If you noticed, the canned water started to come up after the bottle bans started. So.
Right, good. Thank you for coming in, both of you. That was
Thank
great.
you very much. We hope to have your support, because this young lady will be back again. Thank you very much.
Thanks. Appreciate you coming in. Thank you.
Okay, someone from the food pantry, are they here?
Evid-
In or not?
Evidently not.
Okay,
And I
fine.
apologize, I had
Okay.
confirmation, but no.
Let's go ahead to the approval of the minutes then. There's minutes from April 24th and the meeting on July 17th. I'm sure everyone had a chance to take a look at them and comments, edits, anything? If not, we can vote on approval of the minutes. Barry, can't hear you if you're speaking.
I'm sorry.
You're
I
back.
move that we approve the minutes of the April 24th, 2023 Board of Health.
24th,
We got a second on that?
April 3rd.
Hey, Eric, thank you.
I'm sorry, is it April 3rd?
The meetings,
24th.
one was April 24th, the other is July 17th. Those are the 2 minutes
No
there.
problem.
Okay,
Gotcha.
Eric, you're seconding this, I assume?
Yes.
Thank you. Okay, any discussion? Hopefully not. That's good. All in favor, just say aye, raise your hand there. That's the
Aye.
3 of us, yes. Larry?
Okay.
This is from an educational point of view. We can't have you approving minutes when you were in.
Oh, I see.
Even at the
Sure.
meeting.
Makes sense.
Let's say
I
you
did
were on,
read them.
even if you were on the board, but weren't at the meeting.
I see.
We've all made this mistake.
Okay. Thank you for enlightening me.
Of course,
Appreciate
of
it.
course. Now we're on to number 14. Hey, hang in there, everyone. New and old business. one thing I did refer to was probably next meeting being September 18th.
Right.
Everyone's okay with that, or hopefully they are. There's the holiday there in the beginning of September, that's why it kind of bumped us along
Exactly right.
to the second half of the month. So we're looking at the 18th. Anything else for old and new business? Anyone?
I would just like to, have a further discussion on how the enforcement of the bottle ban first is going to go in Yarmouth, and then, we've got another year or two before the restaurant ban, but it certainly affects, I'm assuming, that the health department.
That certainly has, that kind of issue has certainly come up, you're right, Mary Ferris, in sense of, are there enough employees in the health department to be doing this kind of thing? So
And how they're going to do it, because if it's their responsibility, then it's a matter of how that's going to be carried out.
Mary's kind of cut off there. Compliance is going to be difficult. There's going to be an educational curve to that. You're right. It's going to be very time consuming. I think we're going to have to really visit and talk to and educate individuals. But that was my question, to say, where does this lie? I haven't been told there's going to be a health department. My guess is it's going to come down to the health department, and there's going to be a significant drain on labor and workforce for that. No question about it.
Well, that needs to be discussion upstairs a little bit,
Right.
okay?
Yep.
That you have a
Right.
department that can handle this. I'd be curious to see what other towns, if there are any, what they've done
Right.
in their communities, of who's enforcing it.
Right.
What else? Anyone that they want to put on the agenda in the future, or any comments of things in the past? If not,
I'd like to, Hillage, you've had this on the agenda before, but sometime in the fall, get a report on the vaccination rate in our schools, because it's something that is a concern statewide.
yeah, as we discussed last year, we started to see some, in the country, increases in measles, polio, yes, TB. So there've been some diseases that have been pretty dormant, and that's changing. Thank you for mentioning that again.
And apparently it's not required that that schools in the state report. And the article I was just reading said that some 36% do not. So the high vaccination rate statewide, it's 90+%, may be misleading. And it certainly doesn't matter if your own town has a 50% vaccination rate.
Maybe this is something the ambassadors can help us with.
Yeah, right.
Mary, I'll put it on for the next, for subsequent meetings.
After school starts,
Right.
and the nurses have had a chance to get it together.
Right.
Why don't we push it ahead to number 14? How's that? Anyone want to make a motion there? Somebody? Anybody
Sure.
want to leave here tonight?
Move we adjourn?
Is there a second
Second.
motion?
Second.
That sounds good. Let's say there's no further discussion. All in favor of adjourning the meeting, raise your hand, say aye.
Aye.
That's 4, that's unanimous. This meeting is over. Thank you, everyone, for your participation.